Hi Rashim. I'm very thankful that you've agreed to do this video with us. I'll be asking a few questions. Please feel free to stop me if you're not comfortable. Okay. How are you feeling today?
So I'm feeling happy. This was my third scan, completed week 10, and I'm going good as of now. So, like, really feeling happy and elevated.
Okay. Now, this is like your last few days with us here. You'll be referred back to your doctor who will be doing your delivery.
Right.
So, I want to ask you, what were the thoughts when you first came for the IVF consult?
Okay. So, see, this has been a long journey. Before finalizing it over here, I went to 5 IVF center. Initially, I had one IVF failure in one of the South Delhi hospital, and somehow I didn't get my answers from the doctor regarding that failure. So I thought to change my doctor as well as the hospital, and I tried out I think 4 or 5 hospitals in South and even West Delhi. And when I came here, one of my gynae, she referred to me over here. And when I first came here, I was referred to Dr. Sonia Malik, and I shared the entire history. And I think um, it was a very fulfilling and a satisfying in the sense that I got my see as a patient. It is very important for me to have all the answers. I mean,
True, yeah.
at least the tentative situations, if not
Yes.
the exact answers. So I still remember I had a discussion with Dr. Sonia Malik, and then she again discussed the case and handed it over to Dr. Sandeep Talwar. And after talking to both of them, I really felt satisfied, and that was a very informed decision that I want to be here. This place itself, I believe in vibes. So this place itself has a like really positive vibes. Plus, I think those vibes are nothing. I mean, it's not something out of the air, but the people makes the place. So I think the this place, from the doctor till the everybody over here around, be it HR, be it at the desk, or everybody, and they have given always. I mean, from the first visit, I remember, and I've come alone many a times, not along with my husband or any family member. It has always been very comfortable.
That's so kind of you. Also, it's not that you were positive in your first attempt, right?
Yeah.
How did you bring yourself up to the courage that I'm not going to give up?
Okay. So yeah, I mean, I think I would like to talk a bit earlier before that.
Yeah,
You know, that attempt. I think my first victory. See, I focus over the time. I realize her focus should be on victories. Challenges will always be
be
there.
there. Yeah.
So my first victory over here was the way I was being prepared. I think. I mean, I'm not a medical person, but I realized that I have good number of follicles, which led to good number of embryos, which wasn't the case earlier. See, I already had a one experience with a different doctor and different hospital, so I'm not blaming them, but one could make out the difference between two different kind of treatments. And at every moment I was informed why I'm being given these medicines and all that. So my first victory was when I had some good number of embryos, and then I started with my embryo transfer journey. My so once
So
it
there were
came,
many obstacles also to your
yeah,
transfer.
not exactly, in the sense. See, it's just a fear rather than I'll say, because as I said, the team is already like, they inform you everything about it. And yes, I would also like to acknowledge Renika, and I mean she is a wonderful person. I think she manages HR over here, no? So
She's
you
our center manager.
center manager and
Now
a
cluster head, yeah.
wonderful manager. You go to her with any of the issues. She's always open to hear first. Acceptance or acknowledgement to hota hai, but listening is very important.
Important.
So she always listen with a good smiling face and open attitude, which helps me to to approach her every time I faced anything. um, Nothing major, a very minor incident after my egg retrieval. I gave my feedback that patients should be given some solid food after egg retrieval, because it's like overnight fasting, and then it doesn't go well with just a cup of tea. And I'm glad she took that feedback very positively and she made certain changes. So that way, I don't think so there were obstacles in terms of, like, if I say treatment, or with the people, or with the doctor, or with the team. uh, in this journey, obstacle is always like a one's own fear or anxiety. So I think the way I have the support of the entire team, and Dr. Sonu always counseled me, in the sense she always informed me what's happening, what are the possibilities. So that helps me to keep going. So the credit goes to the entirely to the team, and especially to Dr. Sandeep Talwar. I in between I also had, I think, 2 or 3 meetings with Dr. Sonia, and we used to discuss everything. What is the possibility? If this has failed, what next possibilities? And they have never forced me for anything. So I think, yes, after my first failure, again, the attitude, the air in this space, the people in this space, that comfort gave me the strength. Okay, because this all things built trust. Trust is very important when it
Important.
comes to treatment.
True.
So I think I had that trust, and would like to recommend anybody who's going through this journey to at least approach once here with their issues, have a discussion, and then take their call.
Call. Yeah.
Right. So because I it's been a very long journey. So I know I've been to number of hospitals, and to the bigger one. Leading hospitals. But I think the trust over what I got over here is like, it's going to be a long journey again.
What would you tell to other patients who are watching this video? If I were to say to encourage them to meet a specialist, to come to the center, to, sort of get advice and take the decision in the right time.
Right. So I think one difference which I realized over the time is, see, this is a fertility center. I mean, as a patient also, my first advice would be always pick up a fertility center instead of a hospital, because in hospitals, usually you don't, doctors are usually occupied with the outpatient OPD, pregnant women, and equally with the other, like patient like us who are undertaking fertility treatment. But apart from that, I mean, that was a general common observation. But to the those who are approaching the center, I think one of the suggestions which I would like to go ahead is, first, have faith in the doctor. If you have any doubts, if you have any questions, ask them. Ask them 10,000. Good part is, you ask them number of questions, they'll always say, हाँ कोई और question है तो बता दो. I mean, that the attitude which I have seen of Dr. Talwar. So I always used to, as a patient, initially मैं थोड़ा घबराती भी थी. I was like, बस मेरा 2 question और है. She used to say 4 और पूछ ले, कोई बात नहीं. So I think that's very important for a patient. And at the end of the day also, over the time, when you have such a trustworthy team, and no, with all the with all the good treatments, well informed strategies, I mean, whatever they do, they inform you why it's been done. So I think, have trust in your doctor, the team, and also in trust in your own body, rather than being too much thinking about. I know that comes, I mean, it's a journey for me, it's still a journey. But every day I tell myself that now this is going to be a longer journey. And that's, I think, I've been reminding always whenever any IVF failed. I mean, I had almost 3 IVF cycles failed, and there was no reason. I mean, even doctor said that embryos were good, your lining was good, but beyond a point, it is not to raise question, because, as I said, I already have that trust in the team. Beyond a point, you believe that it is not the time, probably. Just keep going. That should be the mantra.
Mantra.
Yeah. Once you have your trust in your doctors and your team, and when you trust your doctor, is for me, is exactly like I'm trusting God, because you cannot directly approach God. it is through your doctors that you say okay आपके हाथ में है. And यहाँ पर मैं दो चीज़ें और शेयर करना चाहूँगी. So one is after my first failure, Dr. Sandeep Talwar recommended to go through AI, artificial AI
हाँ,
testing
yeah,
of
yeah,
embryos.
embryos.
So as usual, I had discussion with my friend, then थोड़ा Google किया, and I said, this will not increase any chances. तो क्यों करना है? छोड़िए. And she didn't force me. She said, ठीक है, fine. As long as you want to go ahead, I'm okay with. But when second cycle failed, she and Dr. Sonia Malik, we had a discussion, and they discussed the benefit of it. Like they said you need to understand what it tells her about your chances of getting pregnant or about the quality of embryo. So it wasn't not forced decision. It was a very well discussed, informed decision, and then that's my last cycle. Usme I took AI, and then how it worked. And just talking about my this last cycle, मेरे 6 एम्ब्रियोज बचे थे जिसमें से 2 बिल्कुल ख़त्म थे. 2 बहुत पुअर क्वालिटी के थे. जो 2 ट्रांसफ़र हुए उसमें से भी 1 गॉट अटैच्ड. बट इट वाज लाइक जब मुझे ये पता लगा ट्रांसफ़र डे पे, the first thought came to my mind. I was asking डॉक्टर सोनू कि अच्छा अब what next, दोबारा से साइकिल स्टार्ट करेंगे क्या. शी सेड डोंट वरी, अभी तो पहले आज ये करते हैं फिर देखेंगे. सो समटाइम्स, एंड आई मस्ट से इन माई केस इट्स माई डॉक्टर्स ट्रस्ट विच हैज ऑलवेज strengthened my trust. And I would like to pay my gratitude over here to Dr. Sandeep Talwar. उस दिन काफी लंबी ओपीडी चल रही थी, so my transfer got a bit delayed.
Yeah, I remember you had come in the first half, and
Yeah.
it was after 6, I guess,
6.
that the transfer
Mine
happened.
was the last transfer. And when they started thawing, first 2 embryos बिल्कुल डेड हुए, सेकंड की 2 की क्वालिटी अच्छी नहीं थी. फिर जो 2 ट्रांसफर हुए तो टाइम था बीच में. सो डॉक्टर संदीप तलवार वेंट टू नियर बाय गुरुद्वारा. आई मीन प्रोबेबली उनका रूटीन भी होगा, बट एज अ जेस्चर, आई मीन I still remember that moment, and I was like, बस अब मैं उठ के hug नहीं कर सकती, otherwise I would have hugged her. Because that shows that how emotionally even the doctor and the team are attached to you, to that transfer, to that baby. So once you get the good news, they also get those smiles, and that's like a winning situation for all. So I'll say this is not a winning for me, it's for the entire team. Whenever I have come like after the positive, so everybody is like with a happy about me, so it's like a family now. So I think, yeah, these two things, I mean, when I said कि मैं थोड़ा और additional बताती हूँ, because and there are so many experiences I can tell you. छोटी छोटी चीजें होती हैं which keeps you going. कभी कुछ आया भी where I felt low, my doctor said ना कुछ नहीं है, we can do away with it, and not like बहुत जो मुझे डर लगता होता है over positivism से. But no, here it is being realistic and take a good strategy.
Yeah.
And that's what a patient requires. See, otherwise,
There's a lot of acceptance which you have to bring to yourself.
yeah, I think, but see, one has to work on oneself as a person, as a person who wants to conceive, because there are so many pressures already from the society. Glad I had lesser pressures, but still I think before the society, it's we as a women who creates 10,000 pressure on ourselves. अभी हो गया तो क्या, इतना हुआ तो क्या, नहीं हुआ तो क्या, एक एम्ब्रियो ट्रांसफर हुआ तो क्या. But it is like a ongoing process. So first is accept yourself that it is okay, whatever situation will come, we have to be ready for it. See,
Yeah.
conception is a starting journey, and it is going to be about a life. Today morning I reminded, and every time I go for scan, इतना बोलने के बाद भी every time I go for a scan, मेरे anxiety pangs होते हैं, ठीक है. But in the morning, while I was praying, I just asked for strength to to deal with whatever comes. I mean, I have faith in Upar Wala. Everything is going good, but it's a journey. So I said, I have, just give me the strength, you know, and I believe in you. So one is have faith in whomsoever you worship, whomso you have faith in, and have faith in yourself. See, even science says until and unless you are not confident about yourself, you'll not get that thing. And ये मंत्र भी है, आप जिस चीज में लाइफ में कॉन्फिडेंट होगे ना उसके लिए आपको सोचना नहीं पड़ता. And मैंने भी over the time किया है. It's not I was like good with this 5 years back or 10 years back or even 2 years back, you know. But I think over the time I realized that you have to trust your body. That's very important. Trust your doctor and team. That's like trusting the universe and the God. And then go ahead. As far as results are concerned, or you can understand it like scientifically also, you have trust in your body, you have trust in God, you have trust in your team, you create lesser pressure on your body, lesser stress, and your body starts working. You know, your medicines give you good effect, if not the worst one or no effect, है ना? तो पॉजिटिव का चांस पॉजिटिव पे ज़्यादा होता है rather than कुछ नेगेटिव होने का.
Yeah. It was lovely talking to you, Rashim. Thank you from Nova South End team for agreeing to do this video. It means a lot to us.
And I must admit, thanks to you, thanks to everyone in the team, and it's my pleasure, or you say it's, you know, sharing of experience is just one part of it. The experience I have over here, I recommend those who are struggling with the fertility issue, those who are struggling to conceive, at least come once. I'll not say कि अच्छा treatment यहीं से लेना है, but come once, have a detailed discussion, and then think what's good for you. Because those discussions I missed in number of, you know, hospitals and with the doctors, because that gives you clarity that will help you to control your anxiety. So I must say, you know, creating this video is something I am like, okay, बहुत कुछ हम नहीं कर सकते, but I am happy to do it. I'm happy to recommend it to others.
Thank you. Thank you so much. Yeah.